Hey, this is Russ. You know, I'm not wearing a black shirt today. Yeah, I've got a red one on, and I've got a sweater on as well. It's kind of cold out there today. I went out and did our snow. Let me show you what the snow looked like in our backyard. You've seen my backyard before. Let me show you before and after of the backyard. Yeah, there's quite a bit of snow today out in our area. And yep, took the snowblower and blew it all out. Did my neighbor's driveway as well. Felt sorry for them. They were out there. The parents were out there. The two little kids were out there. And, when the snowplow comes through, they just pile it on. And I would say we probably had a good 3 feet of snow in front of our our driveways because it piles on higher than what we're used to seeing. So anyways, I did that. And so I got out and had to take a shower because, I'm always sweating after I'm done with that. I don't know why, but that pushing of that snowblower, kind of hard to do. All right, time for updates, okay? So let me give you some patient updates first, then I'll give you my own update, all right? So patient number 4, M, from Canada. Remember this guy? Well, he's going in for a second knee replacement on February 16th. Yeah, he sent me an update, and he's going in for the second one. I'll put a link to his video up here, okay? So good luck to patient 4M in Canada. Hope all goes well. Keep us informed how it went. And then we have an update from patient 5M from Oregon. Remember him? He was the guy that was doing his exercises along the wall, and I said that if my wife let me do that on the wall, I'd be surprised because she wants my feet off the wall. Keep my dirty feet off the wall. Anyways, he gave us a couple of updates here, so let me read a couple things from him. He says, let's see, I keep doing my knee bending exercises every other day. I have tried to lay on my back on the bed and pull my knee up, but I just can't do it on my own. I don't get much flexion. But when I lay on my back on the floor and drag my feet down the wall with clean socks, the wall forces my bend, but I never get past 127 degrees. Now, 127 is still pretty good, all right? I could do 120 on my own right now. Okay, so he says, if they had told me that I would be doing exercises forever for the surgery, I don't know if that would have sunk in, but how long do I have to worry about the dreaded scar tissue growing back? I'd like to quit the exercises. It's getting old, and he's getting old getting up and down on the floor. But I'm kind of scared too. So he's kind of like me. He wants to kind of keep doing the exercises because he's afraid that the scar tissues can grow back, okay? But what is unusual, I haven't done any extension exercises for a long time, and he's still at 0 or 1 degree. So pretty good on that. I absolutely hated the extension exercises back in the early days of recovery. I don't get it. I don't do any exercises for extension at all now, and I'm still at 0 and 1. I think maybe that could be because you're walking and things, right? Maybe that helps the extension in itself. Okay, that's my guess, right? He said, a few weeks ago, I wrenched my good knee putting away Christmas lights in the attic, which meant my new knee is now my good knee. When I went up and down a stairwell, I had to rethink which legs to lead with. Yeah, that's true, because we're always used to going up with a certain knee and down with a certain knee. But now if that operated knee is now technically his good knee, he's got to reverse everything, right? So he says he remember what the therapist taught him. It says, the good goes up and the bad goes down. Yep, it's true. If I thought my knee was all headed, if I thought my knee was all healed after the surgery, boy, was I wrong. My new knee had to recover for my wrenched knee, and it did not do it as well as I would have expected. I am hoping it is just a strength problem with less activities due to pandemic. Long story short, keep doing some exercises as long as you can. Easy insurance to keep your bend. I agree with that. We have to keep going. He also sent me another update. He says that he's decided to stop doing his flexion exercises to see if his flexion will regress. He says, I gave it my all this morning for a final bend, and my wife measured 133 degrees. That's pretty good. 133 is pretty good, but he's going to stop just like I stopped with mine. He wants to see if that's going to drop it backwards or not. Now, let me give you an update on mine because he's given me a good lead in to it. So, I stopped with my Flexion unit from JAS, and I gave it a 2-week time period, just shy. I think it's a day or two shy of 2 weeks. And I decided to go back on it. So I contacted JAS and told them that I was going back on, and they told me to take it easy, don't go too hard in the first beginning stages, okay? But I think I'm still able to do that. I'm still able to do some heavy pushing, but I did back off a little bit, okay? So I was at 120 degrees, and you guys know that. I'll put a picture up here so you can see that. You know that I was 120 on my own without the use of the JAS when I measured it by taking a picture and then putting the photo on the computer monitor and then putting the goniometer on it, and I measure 120, okay? So after 2 weeks of stopping, okay, did I revert backwards or did I maintain it? What's your guess before I tell you? What do you think actually happened? Okay, let me tell you what happened, okay? I measured it again before starting with the JAS unit, and I am at 4 degrees down. So yeah, it reverted back by 4 degrees. Now, I did do a little bit of knee bending. You know how I like putting my foot up on the steers and doing like a deep lunge type of thing, okay? I did several of those before I took this measurement, okay? And if you look at the photo, it is at 116 degrees, which means I lost 4 degrees. And this is why I refuse to give back that Flexion unit quite yet. I would probably give it back to them when I know that after taking some time off of it, it doesn't revert backwards. All right. So now the question is if I waited more than 2 weeks, would it have dropped? Hard to say. Still can't say it. Would it have dropped even further than 4 degrees? I don't know. I don't know how far down it would have gone, to tell you the truth. But I have my doubts it would be only 4 degrees. I think it may actually go a little lower. So, yeah, I reverted back a little bit. Now, I did push down as good as I could on, how I typically do it on my recumbent bike because it has a higher seat. I lean forward on it to get that knee to bend as best I can, and then I take the photo. So the best I was able to do, 116, normally would have been easily 120, okay? So my question is, when does this stop? And this is why I keep saying we have to keep doing the exercises. Now, had I done exercises and not done the JAS, but just done exercises, would I have kept the 120? Now, that would have been a good test. But, my knee was hurting a little bit after 6 months of pushing it so hard with the extension and the flexion. And so I said, I need to take a break from all this, because when I returned back the extension unit to JAS, and these are the same units, remember? These are not the EZ series. This is the SPS series from JAS, which can convert from extension to flexion, but I never did the conversion because my units are set up differently, and it would have been hard for me to have to do a conversion every single time. So they sent me 2 units. Now, most people don't get this. I am quite lucky that they are able to do this for me, all right? So don't think that, everyone gets that, because don't expect JAS to do that, because they're not going to. That's not how their program works. But they were nice enough to give it to me because I am helping them a little bit in terms of testing out some units for them. So I gave back the extension unit. I am still at 5 degrees with the extension. That has not reverted back. Now, remember, I started at 20 degrees. I worked myself down to 10 degrees in physical therapy. Physical therapy stopped, and then the JAS unit came back to me again to help me out, and I worked with that for 6 months, okay? And I thought I went from 10 degrees to 8 degrees, but after remeasuring it, having my wife do it for me a little bit after I took the break from that, it actually was 5 degrees, and it still remains at 5 degrees. So I kind of think that maybe taking that little bit of breather space for the extension kind of helped it. Maybe the knee was just kind of stressed so much from the constant pushing that maybe it needed several days to kind of regroup itself, and then it gave me 5 degrees. I actually feel that I can walk better now, and just looking down, when I'm in the shower and just looking down at my knees, I always kind of compare the left knee to the right knee to see if this thing is still bending or is it kind of straightened out like the other knee. It is looking straighter. So that 5 degrees is half of where I was when I started with the JAS. So the JAS extension did help me. It didn't go all the way down to 0, okay? But I'll take 5 degrees over 10 any day, okay? So that's basically all I have to tell you about me. Deflection went backwards. I kind of expected it would, and it did, okay? It's proof that it did. And it kind of proved to me that you do have to keep doing something. Now, I didn't do a single bit of exercises at all for this last 2 weeks because I really wanted my knee to kind of take a breather. I didn't want it to do any extension, any flexion. I didn't do anything, okay? Now, my original thought was I'll do some exercises on the recumbent bike or something, but I said, no, let's just take a total breather. It doesn't do nothing, okay? And it went backwards. So keep that in mind for yourself, all right? If you're taking a break from all this stuff, know that it's probably going to go back a little bit. Now, I fully expect it will go back to 120 after I've given it a little bit of pushing with the JAS unit. Okay, it wasn't that hard to push it back again, by the way. When I put it on, I know that they told me don't crank it too far, but I'm able to do it if I needed to. That 4 degrees is not that hard for me, okay? But I am backing off a little bit. I didn't go all the way to its full maximum because I do max out my JAS units because I go that far. I did hold off a little bit, took their advice. Over the next couple of days, I will probably max it out, see where we go. I still feel that little tingling sensation underneath my patella on the bottom, and that happens with or without the JAS unit on. If I'm just like, if I'm laying down and I extend it the wrong way a little bit, I feel it. If I try to flex it a little bit more and move it the wrong way, I feel it. So I don't know if that's normal or what, but my knee has been stressed out for so long, 16 months of exercising it, that I don't know what's normal anymore, but it's got a little scratching feel underneath the patella. Still there, okay? Less, okay? But it's still there. Anyways, I hope you liked this update. If you did, go ahead and hit that like button. Hit the subscribe button if you're new here. And I will talk to you guys next time.